my office, what we decided to do was to try and take it off gingerly, and if we could resubmit it back in, that would be the best approach if there's no decay. Now we've started the treatment. We made a little notch in tooth number 4. And as you can see with the microscope, you can really see where the tooth starts and where the old crown, which is tooth colored, ends. And it should be completely bonded in place. As you can see, there's just a very thin amount of the crown that's there. And we're able to take an instrument and actually separate the two pieces. Here's an example of us loosening up in between here, and it just comes loose. And this is the one that showed a significant amount of decay. And I come in with an instrument, and you will be able to see how it just kind of peels away. Teeth are supposed to be hard, not soft. They should never be able to have that softness underneath the crown. Now, because it's underneath, there's a significant amount there. We need to open up some of the harder area in order to get into it. Otherwise, we would never be able to clean it out. Well, we go ahead and clean it with the drill so that we can get a little better access. And it still has a significant amount of decay. And we're cleaning that up. And if you notice with the electric handpiece, we're able to have really great control. There's no bleeding. And clean that out. And there's going to be some problems with it in terms of getting close to the gum tissue. And that area is underneath the gum tissue. Oftentimes there's a problem with the biologic width, and that will need some sort of crown lengthening if we're going to be able to save the tooth. You always want to have at least, on average, 2 millimeters of space, sulcular space underneath the gum tissue. So you can see that the tooth is getting to be less and less in terms of how much tooth there actually is. So we clean it out some more and place a little bit of cord to push the gum tissue back. There's some decay detector right there. Rinse that off. Anything that's green is considered still decay there. And so they have to do just a little bit more. And we'll remove the bacteria that is actively causing that. We put a little piece of string or cord to push the gum tissue back so that we can be very thorough about getting everything. That didn't hurt the patient at all. And now we're able to get back in there and clean it up in a very thorough way so that we don't leave any decay behind. That's often a problem when someone's working in the mouth, to be sure that you remove the decay. The microscope is fabulous as far as being able to see everything and get a nice view. And be sure that you remove everything so that there's just hard tooth structure. We check that with our instrument. There's just a little bit there, so we go back and want to be sure that it's completely cleaned out. A little more cleaning. And here we are with the buildup. That's something to strengthen the inside of the tooth. You can see a little string there. And we will go back and do a crown lengthening and cover that area and make sure that the crown goes below that if we're able to save it. This tooth here is the one that's loose.